seems the country is slowly but surely returning to some sense and form of normalcy. During his address to the nation just last night, President Cyril Ramaphosa announced that as from today, we no longer need to wear masks outdoors, just in indoor public spaces. So let's get some reaction on the President's address from medical expert and convener of the Progressive Health Forum. That's Dr. Aslam Dasoo. Doc, thank you so much for your time and good morning to you. I think out of everything the President said, definitely one of the highlights has to be the announcement that masks are no longer required outdoors. I mean, what's your perspective on this new sort of announcement from the President, which means that we don't have to wear masks outdoors?
Good morning, Tumelo, and good morning to your viewers. Look, the announcement was pretty much expected. Specifically relating to masks, this recommendation came from the Ministerial Advisory Committee months ago. We've all been expecting this even before the last announcements were made in February or January, I can't even remember. But the point of the matter is that wearing masks outdoors is absolutely of no use. This is an aerosol spread, and in the open air, aerosol dissipates very quickly. So we're not surprised, and this is actually a good thing. Indoors, a different matter, especially when there's poor ventilation. So you should continue wearing your masks indoors. Yeah. And you know, coming up to the flu season, it's helpful for the transmission of other viruses as well.
Absolutely. From a medical perspective, Doc, we're hearing from different, sides of, society, interest groups saying there was a missed opportunity from the President to actually scrap the national state of disaster. From where you stand, was that a missed opportunity by the President, or are we well within, of course, our reality to still remain in the national state of disaster?
Well, I wouldn't call it a missed opportunity by the President. The National Coronavirus Command Council has the responsibility to assess all the facts, particularly the advice of the medical scientists on the Ministerial Advisory Committee. It has serially failed to do this, always overlaying the science with other, sometimes questionable agendas. And we think the President was poorly served once more here. Look, what we had was a piecemeal approach, sometimes rather irrational. You can't have 50% capacity at stadia and then, increase funeral gatherings by a little bit. This doesn't actually make scientific sense. And what we would have preferred is the total rescinding of the Disaster Management Act and the lifting of all remaining restrictions. We're in a sweet spot in the pandemic. There's been a step change in the evolution of the virus. Right. We don't expect that the fifth wave will be any worse, but we could have done away with all of these things instead of this regulatory theater that the NCC puts us through all the time.
The President, on that note, also talking, or rather appealing to South Africans to continue to get vaccinated. Where are the challenges, do you think, in terms of government? Where are they facing in trying to get more and more people vaccinated? It seems there's still an appeal for more and more people to go get the jab.
I think that's right. I think that you have to continue. Now, we have to look at it in the sense of two groups. There's the vulnerable group, the over 50s, and I think we're reaching a higher level of vaccination among them, but certainly not high enough. They make up 80 to 90% of all hospital admissions. So you need to get to them as a priority. The younger people, they're less of a priority, but that's where the bulk of people who are unvaccinated lies. So I think a step change in the program is required. I've watched some, news media, just the general media outlets with these messages designed by, I'm not sure who. Medical communication is a very specialized thing. To get people to buy in to health-related requirements takes a specific knowledge, takes a specific way of communicating. Most importantly, the messaging must come from trusted local community leadership. And that hasn't happened. Your traditional leaders, your nurses who can speak in the idiom to which the community is accustomed. And we don't have that. So we need to do that if we want to step up the vaccination drive. We're just fortunate, but I need to say that with some qualification, that we have a very high degree of natural immunity arising from natural infection. But that has come at a terrible cost. Because those people who are unvaccinated, as I said, make up the bulk of hospital admissions and deaths. but we are at about 80%, perhaps even more, population immunity. So we're okay as far as that is concerned. We should do away with all the regulations now. Just get rid of it. We have enough law and enough power in the executive to deal with any exigency that arises in the pandemic henceforth.
All right, Doc, we have to leave our conversation there. Appreciate you speaking to us. As always, Dr. Of course, Aslam Dasoo, health expert, talking to us, of course, and reacting to the President's announcement of those new regulations just last night.